Welcome back. We will learn a important topic in the hematology, that is G6PD deficiency. Very important topic. Kindly note down. So, first point in hematology, we need to learn which kind of disease it is. So it is X-linked recessive. Right? Then we have pathogenesis. First we will learn biochemistry thing so that you will understand easily. NADP is converted to NADPH, which is reversed with another pathway linked with it. So the enzyme required here is G6PD. Okay, here glutathione peroxidase. Right? So here we have one more step where hydrogen peroxide is converted to water. So this is normally we see in our body. So what is this? You got biochemistry thing. What is this? Yeah, this is the one which I hate in biochemistry. It's the cycles and everything. Still we have to study. Thank God I passed. So it is HMP shunt pathway. Right? HMP shunt pathway. What is the benefit of this pathway? NADPH production, right? Which is a very important component. So what happens here? If this is not there, then this won't be produced. If this is affected, it affects this pathway. And very important thing occurs here is hydrogen peroxide is not converted to water. So what happens? Hydrogen peroxide, which is a and free radical, right, which damages the cell. So what happens? Let's make it in a small note. G6PD def, which leads to increased reactive oxygen species, which is nothing but hydrogen peroxide, leads to induced damage. Hope it is clear. Basically here you need to remember only this much. Okay, that is your biochemistry. In pathology you need to remember this point. Okay, in G6PD deficiency what happens? ROS increases, which is nothing but a reactive oxygen species, which leads to induced damage. Okay, there is no doubt in pathogenesis, I guess. So it doesn't happen simply, right? There should be some triggering point. So we will learn triggers, which are infections, various infections, right? Then fava bean, yeah, the food. So don't eat everything everywhere, right? Then then the drug, anti-malarial drug, primaquine, very important. So there are 3 triggers, right? So next, okay, note it down. So okay, if there is something increasing, this doesn't mean it ends here, right? We need what happens if this increases. What happens actually in our body if this increases? Then increase in damage to RBC. Yeah, there is the point, right? If RBC is damaged, RBC rupture, in where? Blood vessels, right? Where else it will be? If it ruptures, then we have intravascular hemolysis. So one who don't know what is intravascular hemolysis, we have another one, extravascular hemolysis. So look into that video so you will understand better. So here what happens? Intravascular hemolysis. Okay, then what? There is another special thing, don't forget. If ROS increase, then what happens? Slight damage. And whenever I say slight damage, yeah, there comes our spirocytes. And if spirocytes comes in the picture, then we have spleen. Then we learned that in our hereditary spirocytes what happens in extravascular hemolysis. Spleen comes in the picture where macrophages eats ice cream. Then if macrophages eats ice cream, then what happens? Then what happens? Yeah, remember I taught you in spirocytosis chapter. Yeah, then what happens? Your extravascular hemolysis happens. So yeah, no need to see that video, here only you got it. What happens in extravascular hemolysis is spirocytosis will be like densely packed, where they won't be like this, like regular biconcave shape. What happens? They won't mold and all, so they go to spleen. If they go to spleen, then spleen macrophage littoral cells engulfs. Then what happens? Extravascular hemolysis happens. This is the basic. So the important point why I taught you both here is, so you see both here. What happens? Extravascular also happens. You see extravascular also, you see intravascular also. So speciality of this G6PD deficiency, you see both intravascular hemolysis plus extravascular hemolysis. Very important concept, don't forget about this. Make a note of this, very important. So where you see both intravascular and extravascular hemolysis, it is in your G6PD deficiency. So this is your pathogenesis. I hope there is no doubt in pathogenesis, right? Then what happens? These ROS are not decent people. These people further damages something else. What they causes? They causes hemolysis. Then what happens? Causes denaturation of globin. So हीम तो गया, अब ग्लोबिन का क्या होगा? तुम्हारा क्या होगा कालिया? Then hemoglobin gets precipitated in RBC. So this gives to a very important MCQ and a very important finding called as anyone knows? Any idea what it is? HEINZ, Hin's body. Yeah, very important. Where you see Hin's body? G6PD deficiency due to denaturation of globulin. Okay, hope this is clear. So how you are going to find this Hin's body? So we have two stains. One is supravital stain. Then we have Leishman stain. In like usually this is like when you see in microscope, let me draw you for. See, there is something bitten like thing, right? This bitten part, this portion, complete portion you will see in supravital stain, which appears in greenish color, sorry. Whereas in Leishman stain, you see it as a bitten type, right? this portion is missing, right, which is called bile cell. Okay, I hope this is clear, right? In Leishman's stain, what you won't see, this portion of his body is not visible. Okay, but in supravital stain you will see complete cell. Okay, right, I hope that is clear. So what is the use? Let's come to the patient OPD thing. Okay, patient, come inside. So these will be usually poor man with a trigger factor plus very important, episodic hemolysis. These will be your clinical features, right? This will be episodic because whenever he exposes to trigger, this shows hemolysis. Okay, so on peripheral smear you will be going to see these two. Peripheral smear, what you are going to see, Heinz body, that is supravital and Leishman's stain things. Then we have investigation of choice. Investigation of choice. What may be investigation of choice? Anyone? Yeah, that is, we have enzyme deficiency, which is leading to this problem, right? So we have to do enzyme analysis. Yeah, so at last we saw the patient, then we spent his money, and we did everything. What is the purpose? The purpose of in doing investigation and asking the story is just to treat him, right? So we ask him to prevent triggers. As usual, it is generally like mild and self-limiting, and you have to treat like patient Aya, and you said okay it will get reduced, and patient will say then why did I come to you? You have to say something, or you have to give something. That is nothing but your symptomatic treatment, which plays very important. Okay, I hope there is no doubt. So let's revise it quickly. So today we learned a very important topic, G6PD deficiency. It is a X-linked pathogenesis, HMP shunt pathway. You saw like what is the importance of it, NADPH. So when it comes to pathogenesis, G6PD deficiency, which increases reactive oxygen species, mainly H2O2, which is hydrogen peroxide, induced damage. What it happens when ROS increases, it increases RBC damage, then RBC rupture in blood vessels, which lead to intravascular hemolysis. Whereas don't forget, ROS increases, which leads to slight damage, spirocytes will be there, which enter spleen, macrophages of littoral cell, ice cream, then they will eat EVH, then they will eat spirocytes, which leads to the extravascular hemolysis. So what is the important point you need to remember here? That is both intravascular and extravascular hemolysis will be taking place. Okay, then we saw how patient look. Oh no, then we saw another extra edge pathogenesis, that is ROS causes denaturation of globulin, which leads to hemoglobin gets precipitated in RBC, which shows Heinz body, where in peripheral smear you will see supravital stain, using supravital stain and Leishman stain. In supravital stain we see complete RBC without any bite mark. So in supravital stain it will be green color. Then in Leishman stain we will see a like bitten mark, which is like bile cell, we call it as bile cell, right, where complete part is not visible. Then we saw investigation of choice, which is enzyme deficiency. So we do G6PD analysis. Then what is the treatment? It's very simple, prevent the trigger. Then mild and self-limiting it is, you have to assure the patient and give him the symptomatic treatment so he'll get calm. Okay, that's it. I hope you enjoyed the video. Many of them just watch and go the video. Kindly subscribe so that you will find my latest videos, right? I hope you enjoyed the video.